Hi, my name is Dr. Erin Daniil with Rejuvenate Life Chiropractic, Rejuvenate Life app, and today I just wanted to share a little bit about my journey. I've also written a book, Healing Through the Storm, How to Restore Health While Life is Happening. And life happened this week for me. So what happened? Okay, so I'll do my best to explain. So I had surgery mid-August on my left shoulder, and was having difficulties with it. It wasn't healing right. It wasn't getting full range of motion back. Things were looking a little strange. Nothing presented, in any strict pattern. Like, it wasn't frozen shoulder. It didn't present like that. It didn't present like an infection. It didn't, wide variety of stuff. So followed up at my normal 2-week, 6-week with my surgeon. My surgeon at 6 weeks said, I want to see you back in 3. At that time, he said, something's not right. We need another image. So went in for my MR with contrast, so an MRA, angiogram, and nothing showed up. Did some blood work for infection, nothing showed up. So still suspect of an infection, right? Because something is just weird. So doc went in and tons of scar tissue all over the place, all over the shoulder. He said it was kind of like cement. So when I was knocked unconscious, under anesthetic, could not move my shoulder. So there was reason that I could not move my shoulder. So when we're in there, we take some cultures because now it does look like an infection because it's like crazy growth that should not be there in that short a period of time. I was only immobile for 2 weeks. I was doing my exercises. Those of you know I do exercises. So anyway, Friday after Thanksgiving, I get the call that says, yes, the joint is septic. So I spent 4 days in the emergency room, or not in the emergency room. I started off by going to the emergency room, spent a total of 4 days in the hospital, and then got released with a PICC line. So I will be doing antibiotics for the next 40 some days via a PICC line, trying to make sure that my joint heals. So far, all blood was clear. Haven't seen any sepsis actually in the bloodstream, just in the shoulder itself. So it has been interesting. So when I talk about healing through the storm of life, and I say the path isn't always easy and there's always something to come up, there will always be something to come up. And so the biggest advice getting through stuff is just take it each day at a time, take it what you can control. So while I was in the hospital, I could control getting up and walking and moving around. I could control as far as doing my shoulder exercises so that I continue to have more motion with this shoulder. So it's already moving way better, doing more with the shoulder than I had after second surgery than I had been with the first surgery. So that will all continue and everything will go just fine. So stuff that I can control, right? That's what I always have my patients focus on, is the fact that I have been blessed by an amazing father who had flown in for my emergency surgery. He flew in that night. And then he was able to stay an extra week. So he helped me with my children and with my puppy. And I've had a lot of people reach out and say, hey, what can we do? What can we do? I'm going, I'm kind of tied up, in the hospital, not much that we can do. But I am still in my office. I am still working. I am, it'll be instruments adjusting on my vibration machine that I have been using. We'll just go on the, same path that we have been going on. And I might have some restricted hours here or there. I'm not sure yet, just because I don't know how my body is going to respond to all of this. So I might shorten things up just a little bit, but I will still be here. I will still be available. And so overall, I'm doing, fairly well. Just a little bit on the tired side, but nothing that is not manageable and nothing that is really any different than has been going on for the last 3 months. So again, I'm Dr. Erin Daniil with Rejuvenate Life app, Rejuvenate Life Chiropractic, rejuvenate-life.com. It's important what you do with your dash. So you can find me in all of those places. But I look forward to working with all of you on your healing journeys if you want to embark on that journey with me. So have a fabulous day.